Hi everyone, this presentation goes over Chapter 6 on co-authoring in the third edition of Jacobsen's textbook, Introduction to Health Research Methods, a Practical Guide. In this chapter, you will learn that decisions about co-authorship should be made early in the research process. Here's an outline of the chapter. It's a very short one. Section 6.1 goes over co-authorship. Section 6.2 goes over authorship criteria. Section 6.3 goes over authorship order. Section 6.4 covers decisions about authorship. So Section 6.1, co-authorship. So the process of two or more collaborators working together to write manuscripts is co-authorship. Most researchers serve as middle authors before becoming a lead first author. So if you're a student working in a lab, you may work on some of the tasks within a project and be able to be an author on that project, but you will probably start off somewhere in the middle, not at the beginning and not at the end. Decisions about who qualifies for authorship should be transparent, so it's good to know up front when you're working with someone whether or not, if it results in a paper, whether or not you would be considered an author or potentially be acknowledged in the project. Section 6.2 goes over authorship criteria. So there's a great criteria set up by the International Committee of Medical Journal Educators. This established criteria is used a lot in the health sciences and is adapted by most journals. So whenever you submit a journal article, there usually is a statement that talks about contributions and what people's contributions are to the research. And they will want you to meet certain guidelines in order to be considered an author. Anyone who does not meet the specific guidelines or criteria but contributed to the project in some form or fashion can be included in the study acknowledgments. And so all four ICMJE criteria should be met to be a co-author. So to be a co-author, you should make a substantial contribution to the conception or design of the study and or data collection, analysis, or interpretation. So the key here is and or. So you don't have to be involved in all of these aspects. You need to be involved in at least one of this first component. The second is either drafting the article and or providing critical revisions of the intellectual content. So you don't have to write the full article to be an author. You may be someone who provides feedback on the article. But just reviewing it and saying you have no feedback doesn't usually cut it. 3 is approving the final version of the manuscript that's submitted to the publisher. So this is really just making sure that everything is correct when it's finally submitted. And 4, accepting the responsibility for the integrity of the paper. Now, authorship criteria, there are also some different situations where things may occur where people may be authors that should not be author, or people are not included as authors when they should be. So the first thing is there should be no ghost authorship. And this is failure to include someone as a co-author on a manuscript who made a substantial contribution. A gift authorship is adding someone as a co-author who didn't actually substantially contribute to the project. So section 6.3 goes over authorship order, and so this is sort of a standard structure of how authorship is set up. So the first author usually takes the responsibility for most of the writing and correspondence with the journal. This is typically the lead author. It may be the principal investigator of the study. The middle authors usually are listed in order from greatest or least contribution, alphabetically or by family name, or depending on the discipline here, sometimes certain disciplines find second author to be the second most important or the supervising author versus the senior author being the last author. So in public health, typically, let's say you're writing a thesis for a master's program or a dissertation for a PhD program. Your first authorship is the student doing all of the work, the student who's writing the thesis or writing the dissertation. The last author, the senior author, is probably their dissertation supervisor. The middle authors may be the committee members that may help on that project, and they can kind of be disseminated differently based on their contributions. And so, as I just mentioned, the importance of authorship may differ by the discipline. The second author could be the senior author instead of the last author in some fields, such as, say, sociology. Section 6.4 goes over decisions about authorship. These should really be made as early on as possible in the research process, and authorship should be considered flexible for changes based on the contribution. I've worked on a grant recently, and it was led by Dr. Brown, and she had some different papers set up front. It had 5 different papers, and there were 4 faculty, and so, there'd be one faculty would have been lead author on each one of those papers. Dr. Boateng, who was a tenure track faculty at UTA for a little while, was a lead author on one of those papers. Well, then he left the university, and so the decision had to be made of whether or not he continues on the project even after leaving and being the lead author, or that lead authorship goes to someone else. And it's also important to note that co-authorship and the order may be different for posters, oral presentations, and manuscripts. So for poster presentations, a student usually will be the first author. And for an oral presentation, the student, if they are presenting, they may be the first author as well. Versus a manuscript, if it is led by a faculty in a lab, and they're doing the main research, the bulk of the work, then they may be considered the lead author on that. Okay, so that is it on Chapter 6. Thanks for listening.